All right. So welcome everybody. Our agenda today is going to start with a presentation on major crime and policy. This was really hard to do. There's so much crime. You probably don't know this, but behind the scenes, we actually choose from a dozen different counterfeit crimes that happen in the US every week to make our weekly video on YouTube. We picked the ones that we thought were either the biggest or the ones that represented trends that we thought that you couldn't possibly fail to pay attention to because they meant something important for the future of patient safety. Then we're going to do just 5 to 6 minutes on policy and go through the major policy proposals that are out there at the federal level that talk about what would make the counterfeit problem in pharmaceuticals better or worse. And then we're going to do Q&A. So I know I promised you a 20-minute presentation, ended up being 16 because I edited it really aggressively. I hope that's okay. A couple ways I just want to mention before we go, how you can help. We would love it if you would subscribe to our YouTube channel, follow us on social media, and join our email list. And that's all because we work really hard to produce really good stories every week in a very short format. It's very hard. None of us are professional video editors, but some of us are professional writers. And we work really, really hard at accurately sourcing everything. There's a lot of material we've never been able to use because we couldn't source it. And that would all be helpful. If you're a nonprofit, we would love it if you would join PSM. We cannot take for-profit members or for-profit money in any way. It's been over 5 years since I set that rule in place, and I believe it served us well. And so we would love it, though, if you're a nonprofit, if you could join us. We have a sliding scale of dues appropriated to what your priorities are. But we really do appreciate if everybody chips in something. So we would really love if you are somewhere in the supply chain delivering pharmaceuticals to patients, if you would join us. The video I'm about to show you and this whole presentation will be up on YouTube, and there will be an extremely heavily sourced blog post with all the cases we're talking about and all the trends up on our website with that video embedded. It'll probably be up tomorrow. And we're very, very excited for you to use that as a backup. And I'll email you all about that when it's up. I just want to take a moment and thank the people that have no public face to the organization, but work extremely hard. They affectionately have labeled me a chaos muppet because I am very hardworking, but I have a lot of ideas. And here I just want to make sure that I've said thank you to them, to Deb, to Eva, to Liz, Sarah, Tyler, and Veronica. Everything you see, if it looks good, it is all because they work very hard at writing, illustrating, and planning and managing. If it looks terrible, it's all my fault. Really quickly, our membership is comprised of everybody along the supply chain. Again, if you are not a member and you are a not-for-profit, we would love to have you. We've got representatives of every part of the supply chain that touches that medication, and we would love to have you as well. So let's go ahead and start the presentation.
The crimes and trends we're going to cover in the first 10 minutes are the ones we believe are either too big to ignore or demonstrate a trend that you should be paying attention to. We're going to cover a lot, but you can find links to all of this on our website. In September 2017, we released our first of its kind report, 40 States and Counting. It warned that counterfeit pills with fentanyl were spreading across the country. And this month, fake pills with fentanyl were found in Hawaii. With that report, there are now lab-confirmed counterfeits with fentanyl in every state. Deaths from these pills are only recorded in 42 states. We suspect that is simply because toxicology isn't done universally for overdose deaths. COVID-19 pushed the opioid crisis off the front page, but it didn't end the crisis itself. This year, the Mexican cartel industrialized their production of fake pills and became the dominant producer. The lockdown hasn't stopped these cartels from shipping their illicit goods over the border, and they've got decades of experience smuggling illicit medicine. Car batteries, fake burritos, ceramic tiles, and corsets are all some of the places Customs and Border Protection discovered hiding fentanyl pills just this year. In 2019, PSM, along with the National Association of Boards of Pharmacy and the National Association of Drug Diversion Investigators, released a report warning that illegal pill presses pose a threat to all Americans because it gave counterfeiters an adaptable capability. When you're done making Oxy, you can pivot to Xanax with just putting in a new mold. When you don't have access to fentanyl, you can use methamphetamine or ISO. We predicted that the spread of pill presses meant that we were now dealing with an innovative industry of adaptable counterfeiters for at least a decade. We have never been more disappointed to be right. We're now seeing fentanyl pills pressed into very unusual formats. Since June, police in Ohio issued a warning after seizing counterfeit Aleve made with fentanyl, while law enforcement in Arizona seized fentanyl-laced fake baby aspirin and metformin. All the pills tested positive for fentanyl, and the existence of these pills will leak out of the addict community and claim lives everywhere. We suspect these pills were made to allow dealers and buyers to carry the pills as a form of camouflage, not because there's a lot of money in fake baby aspirin. However, the potential for someone to die because the pill looked like something they know and trust is significant, and it has happened before. The biggest case of the year just had its sentencing last week. From December 2015 until he was arrested in Utah in November 2016, Aaron Shamo ran an enormous drug manufacturing ring that sold hundreds of thousands of fentanyl-laced counterfeit pills on the dark web. Agents seized 70,000 pills, over $1 million in cash, and industrial pill pressing equipment. A sentencing memorandum filed by prosecutors in federal court this September stated that Shamo's drug ring shipped fentanyl pills to every single state in the union. Data retrieved by federal agents of Shamo's sales on Alphabay showed he sold significantly more than 458,000 fentanyl-laced oxycodone pills. No one will ever be able to say how many lives Shamo destroyed, but to quote federal prosecutors, his prolific distribution of drugs led to incalculable loss and suffering. After being found guilty at trial, Shamo was sentenced this last month to life in prison. As we predicted, counterfeiters with pill presses saw an opportunity in Adderall. It's a medicine that is used heavily by young people who, as we know, don't possess the greatest of judgment or an understanding of the secure supply chain. They often trade pills amongst each other without regard for the dangers of counterfeits. Because of the limits on access to Adderall and the market potential, counterfeiters began pressing fake Adderall with methamphetamine. The most recent state to issue a warning was Iowa. What these users did not know is that these Adderall pills were just straight up methamphetamine. In fact, over the past 24 months, we found reports of fake Adderall made with meth in 7 different states. Texas has had 2 notable cases involving fake Adderall pills. In December 2019, a lecturer at the University of Texas was indicted for her role in a counterfeit Adderall pill ring. Just 2 months earlier, a defendant in another case received a 30-year prison sentence for selling counterfeit pills, including Adderall made with methamphetamine. The proximity to students who often abuse Adderall as a study aid is notable, along with the enormous quantity of pills seized in this case, over 350,000. In June, Ontario Provincial Police announced a major fake pill drug ring bust and seized a historic amount of fentanyl. Over 123,000 fake pills made to look like legitimate Teva Oxycocet and 154 pounds of fentanyl powder. The investigation began in April, with agents making their first arrest in British Columbia on May 27th. 3 days later, law enforcement shut down the Ontario-based part of the ring. These traffickers even went so far as to duplicate the labels that would be found on real Teva Oxycocet bottles. These are not individual patient bottles. We found this case notable because they were specifically making pharmacy-sized wholesale packaging. While the Canadian drug supply chain within Canada is pretty strong and pharmacists are very diligent, the fact that they were targeting wholesale packaging is a trend we are not welcome to see and we should all pay attention to. In the same month, police in Italy seized 84 million Captagon pills containing methamphetamine that were produced by ISIS in Syria. Authorities in the port of Salerno found the pills worth over $1 billion inside 3 shipping containers. Counterfeit medicine is a financial bonanza for criminal organizations and terrorist groups who are always looking for new streams of revenue. Our favorite case of the year is the bust of the Ukrainian counterfeiters called Healthy Nation. They were selling counterfeit versions of Epclusa, a drug that treats Hep C, and Abraxane and Keytruda, drugs used to treat different kinds of cancer. Because the criminals operated out of Ukraine, where the U.S. has no extradition treaty, The fact that these criminals are today sitting in US jail awaiting sentencing is a real testament to great police work. We think this is one of the most interesting crimes we have studied all year. The full story of this is so good, we're doing an entire episode on it. They're set to receive their sentences next month, so look for our episode on this crime in mid-November. But there's no avoiding the elephant in the room. The global pandemic has affected all of our lives, and scammers were some of the first people to quickly pivot and take advantage and prey on people's fears. This chart shows the number of domain names being registered from January 13th through April. The blue and red lines represent how many websites each day were being registered with either coronavirus or COVID in their names. The blue line represents websites with a low risk score of being scams, while the red line is for websites that are most likely scams. As we've learned from the NABP's fake pharmacy report, criminals are good at flooding the zone so that finding an honest vendor is impossible for most Americans. What sort of scams were they doing? The short answer is all of them. Fake and substandard PPE, preventive medicines that don't stop anything, bogus cures and bogus medicines and bogus vaccines that don't even exist yet. And people lost money through scams from phone, text, email, and other ads on the internet. Most of the items in these pictures were seized by Customs and Border Protection before they could harm anyone. But the gloves, they were sold separately to companies that employ frontline workers. Even before there was any vaccine for COVID-19 that you would want to take, we saw criminals selling fake COVID vaccines online. There have been 2 instances thus far of criminals selling fake vaccines online, and probably more we never even got to see. Longtime counterfeit crime buffs remember when it was discovered that someone had faked an entire Apple retail store in China. This technique has come to the pandemic. A fake drive-through COVID-19 testing site popped up in Louisville, Kentucky earlier this year. They were not sponsored by any health authority, hospital, or health plan. They didn't have a partner laboratory processing their tests, and when confronted by media and a city councilman, they packed up and ran. But they were collecting money and swabbing people. It's not known how much they got away with before being caught. This final story is one we've been trying to cover for months. Hand sanitizer made with methanol. Methanol is not supposed to be in hand sanitizer, and it can kill you if you ingest it. Poison control centers all over the country are reporting people drinking hand sanitizer, and when it contains methanol, it can be fatal. Additionally, the FDA has caught a number of vendors packaging their hand sanitizer in ways that closely resemble children's snacks, adding to the danger of poisoning. We keep waiting to publish a report on this trend, but it doesn't seem to be close to over. We are very grateful to the FDA's diligence in this area to protect Americans. The PSM team loves counterfeit drug policy like nobody else. On our website, you can find a copy of our policy positions paper containing all the positions and legislation we've been tracking and have taken a position on. Everyone has heard of domain names. It's like the shorthand name safemedicines.org that you type, so you don't have to type a numeric internet address. Can you imagine being a detective investigating a dozen drug stash houses in your city without being able to find out who owned the properties? Now imagine investigating a fake online pharmacy network of 200 cookie-cutter pharmacy websites and not be able to tell who owns them. Law enforcement and public access has been limited to this data in recent years due to unfortunate side effects of the European Privacy Directive. We need transparency restored to how it's been since nearly the founding of the internet. Additionally, some domain name vendors have started catering to criminal enterprises, and they refuse to turn off domain names even if presented with evidence of a crime, much like some banks in the Caribbean cater to money laundering. Changes in existing law to create a lock and suspend obligation for domain name sellers are needed. Sales of counterfeit medicines through social media and online platforms is not a new problem, and it continues to be deadly. Just this year, we met a family whose son was killed by a deadly fentanyl pill sold by a Snapchat drug dealer. We don't believe the platforms when they say there's nothing they can do to find and restrict this kind of criminal behavior. They currently enjoy legal liability protection from being held responsible for it. And while that liability protection is important to protect free speech also, we don't believe it's absolute. We support creating a duty to report counterfeit drug selling activity for online platforms. We look forward to seeing the legislation that comes out in the next Congress on this issue. You know the danger of a widespread cottage industry of pill presses, and there's a creative solution. Increase penalties for crimes involving controlled substances if you are convicted and you had a counterfeit pill press mold. The bill to do this has bipartisan support, and carefully avoids the tricky issues of convincing prosecutors to bring new charges, and it only kicks in if you're convicted. In this Congress, it's Bills 4510 and 2573 in the Senate. PSM has partnered with law enforcement as they are on the front lines of interdicting counterfeit drugs, and we support giving law enforcement the tools to combat them, especially fentanyl-laced counterfeits. We proudly support the POWER Act, S954. This bill will provide grants to state, local, and tribal law enforcement to purchase chemical screening devices to detect illicit drugs, train personnel to use those devices to enhance law enforcement efficiency and protect the officers. With dozens of chemical analogs, the fentanyl problem, including the importation of fentanyl from foreign countries into the US, is going to be with us a long time. As such, we're pleased to support two bills that help combat this crisis. These bills will hold countries accountable that don't do enough to stem fentanyl shipments. Additionally, the bills will close the loophole for illicitly manufactured fentanyl and study the production of illicit fentanyl in those countries. Inspectors in international mail facilities have said that they have more power to destroy counterfeit medicines than they do medical devices because of a weird oversight in the Food, Drug, and Cosmetic Act. And while people who smuggle counterfeit medical devices often make other mistakes that allow inspectors to seize and destroy them, sometimes it can be a challenge. With the rise in COVID scammers making fake medical devices of all kinds in record quantities, this is a critical fix right now. It's a simplistic edit to the Food, Drug, and Cosmetic Act. It's so uncontroversial that the House version passed via voice vote recently. There's a bipartisan companion bill in the Senate, S4225. We hope that this can pass this year or quickly next year. Unfortunately, the policy that people love to talk about the most is also most likely to put a giant safety hole in the supply chain, and that's Canadian drug importation. We focus on it because it's been tried before and endangered patients. It has never saved the money it keeps promising to, and it's currently being implemented in 8 states and has been debated recently in 20 others. Just a few weeks ago, HHS and FDA finalized the federal rules on how a bulk Canadian drug importation plan can function and drew out clear requirements. Florida, Colorado, and New Mexico are all racing to submit applications to get permission from HHS by the end of the year. Some states have figured it out though. Both North Dakota and Wyoming have had outside consultants look at this issue and recently found that these programs can't possibly work. Both states avoided spending a lot of hard-earned tax dollars that Colorado, New Mexico, and Maine are about to set on fire. The most frequent question I get at the end of my presentations is, if this is such a doomed idea, why do politicians keep proposing it? It's because all the realistic proposals to lower healthcare costs are just as complicated as our spaghetti healthcare system itself, and also just as politically difficult. Politicians like these ideas because they're easy to understand and take so long to implement that they expect not to be around when they fail, or that you'll forget them entirely, or they can just blame Canada. But bad policy is dangerous when it touches real medicine. We will be doing everything in our power in 2021 to shine a light on these policies and document their dangers. Hopefully, this time, people will learn their lesson.
All right. Thank you, everybody, for taking a little bit of time to sit with us while we went over what we think are the most exciting cases and trends. I've got my colleague who works with law enforcement organizations and is an expert in illicit trade for nearly 20 years with me, Sven Bergman, and we're going to go through your questions that you might have. Let me just share our screen so you can see our contact information and you can see the other information. So the recording you just saw, which we actually edited because we thought it would be faster and more concise to do it that way than to just go through slides and talk, because I tend to meander, will be on YouTube this afternoon, and the whole blog post that goes through each of those cases and the trends and all of our coverage will be on our website tomorrow. And so we'd be very excited for you to share that and pass that around. If you have questions right now, you can go ahead and put them into the question box or the chat box, and we can handle them. One of the questions that I got is, and let me actually just turn poor Mr. Sven's camera on. I've got this often, is why would people put fentanyl in in baby aspirin. And I tried to address that. The fact is that it is uh, a method of camouflage, right? There's no big money um, in baby aspirin that allows you to put fentanyl in it, and that's just not the reason you do it. I believe you do it for camouflage, but we have so many stories of family members who lost other family members to counterfeit medicines that it's just legion. Um, it's really really awful. Okay, so let's see. Let me look through what other questions we have. And I apologize. Sven says that his camera is not being turned on, and I can't figure out why to do that. How to fix that? We may have to only hear Sven.
That's okay.
All right. So here's another interesting question, which is, what do the Canadians think about proposals to import medication by states like Florida? So this is actually a really interesting problem. The Canadians are not pretty happy about it. The Canadian drug supply is quite small. They don't make most of their own medicine. They make about 20 to 25%, I think, of their own medication. They import most of it. And they don't get, huge shipments every month, and they, experience large, healthy warehouses full of extra medications. They're actually in drug shortages that were terrible before COVID and have gotten much worse right now because of the COVID. And they're not happy. They figure that if 20% of U.S. prescriptions get shifted to Canada, they have about 6 months before their supply runs dry, and they're really unhappy about this. There is a related question from Kate. Hello, Kate. Saying that what is the update from the Canadian pharmacists about the upcoming election and changes in this policy? So the Canadians are even more concerned than they were before. If you add up all the states that are actually talking about importation, it exceeds the population of Canada, which is 1/9 the population of the US. They, along with the shortages caused by COVID, they are actively lobbying their federal government to step in and do something about these plans to import drugs from Canada, which do need federal approval. So there is a role for the federal government to play if they decide that they would like to keep the Canadians as a friendly ally. I think the biggest tragedy of all this is that it distracts from real structural change that you might need. Like we've seen states eject PBMs like West Virginia, save $54 million in their first year of doing that. And so there's clearly a lot of money to be taken out, that's being taken out of the system by people that don't necessarily seem to be saving money for the people they promised. Here's another great question from Ed. What is your best estimate on the number of fake fentanyl pills in circulation in the US at any given time? That is a great question in which I feel I don't have the data to answer. And as you've worked with PSM, you know that we're very, very careful about our sourcing. We routinely see seizures of 100,000 pills or pounds and pounds of fentanyl that get presumably made into pills or added to illicit drugs on a monthly basis throughout the country. The DEA must keep warehouses, set aside for capture and destruction of the amount of fentanyl and fentanyl pills that they find along the southern border. But I've never been comfortable estimating the actual size of the counterfeit drug supply because it's so often underground. So I can't really answer that effectively. Here's a great question. Do you know if anyone has applied to become a vendor for states who have passed import programs, and if so, who? That is a great question. The way the process works is that a state puts together an application with the name of a foreign seller, which is supposed to be Canadian, a US importer, and a list of medicines they want to import, and they submit that whole thing to the FDA. And the final regulations that came out said that they can submit that and not name that vendor for 6 months. So as of today, we actually don't know. There's been no application submitted, and even after there are, I suspect they might mask the identities of their vendors. The Canadian Wholesalers Association has said that they are universally against this program. That doesn't mean that there isn't a rogue wholesaler that might decide that they want to apply. But to date, no one has ever been publicly identified as being a Canadian wholesaler who is willing to work with this program. And no one, to our knowledge, has applied to either be a registered foreign seller with the FDA, and no application has been submitted that has that. And so that is where we are today. But like I said, New Mexico, Florida, and Colorado are all racing each other to get an application in close to the end of the year. And I suspect that at least one or two of them will make it. Question. What is your involvement and or anticipation in regards to the approval and distribution of potentially counterfeit COVID vaccines and increase of domains that will allege to offer as such? So we are honestly pretty scared that is coming from that we're going to see. We've already seen fake vaccines being sold today, and obviously fake treatments as well. And I think that there's really a tremendously dangerous phase we're going to get in once there are real vaccines in the marketplace, and people now are not clear about the fact that the supply chain is so important. And so I think it's going to rise. We ourselves are talking about counterfeits in the hopes that we can continue to get people's attention to talk about vaccines. We have no formal involvement in anything related to that. I certainly hope that some part of the FDA or the CDC is going to actually take a different tack than they have so far and really do a high profile push about how you should not buy your COVID vaccine online. I think that would be very, very important because Americans are not so good at the supply chain. Sven, there's a question here in the Q&A section I really would like to answer about what goes into identifying counterfeit pills and tools local law enforcement and public health departments need. You work with law enforcement every day around the country. That's your area.
Yeah. So with counterfeit pills, there's several levels that law enforcement needs. So I'm going to start with the most basic ones, and that is they need resources. If you think about the fact of controlling counterfeit medicines, often is on top or in addition to a lot of work and jobs that law enforcement already has, public security, etc. In the middle of the COVID epidemic, that actually became even harder since a lot of law enforcement actually were infected by the virus initially. New York PD at one point in time had 35% of their officers infected and not active. So there's a resource stretch. So that's the first one. In addition, and we see that, for example, in certain cities like Los Angeles, they actually put special anti-counterfeit squads together, or units who are trained specifically to look for counterfeit medicines, since that is not something that normally should be mixed into the day-to-day responsibility of any law enforcement officer. So it's resources. The second piece of that is it's training. It is being able to identify, either through the packaging or through chemical testing, what is or isn't a counterfeit. The trickiest piece, especially about the fentanyl pills that have been showing up, or poison pills that have been showing up increasingly in the United States over the last couple of years, is that they do not show up in always in packaging. They show up in bags or baggies. And so at that point in time, law enforcement has to test them and has to ensure that that is not a toxic substance. Often that means for them, law enforcement having to be able to have access to a state lab, which can take sometimes weeks, or at a couple of law enforcement conferences you and I spoke, where it can actually take months to get results of what it was. That's one of the reasons why the POWER Act, for example, is so important, that law enforcement has actually testing devices within their vehicles or within at least their own office or department to be able to instantly test for various bad substances. In addition, I think there's a strong continued need for strong private public partnerships between law enforcement and companies to help law enforcement detect counterfeit, because it's not just fentanyl pills. It's also counterfeit of blood pressure medicine, counterfeit of all types of medicines, and really working with public-private partnerships to ensure that those resources can be accessed. I think those are the things that are needed. And the last thing that I think is always needed is to ensure that penalties for counterfeits and penalties and fines for counterfeit and counterfeit trafficking are adequate to be a deterrent for criminals to not engage in the crime. During the COVID-19 pandemic, the amount of counterfeit PPE highlighted that those penalties are not currently sufficient to be a deterrent, because counterfeiters jumped into the breach to counterfeit this. So those are a couple of the aspects of what I think counterfeit what law enforcement department needs. I hope that answers the question.
Thank you, Sven. And I'm going to quickly answer this other question before we move on, because it's related to the PPE point you made, which is, what insights do you have around the government's plan to protect frontline workers against fake PPE? I think, and this actually is related to importation, we saw a strategy that I think we can now evaluate fairly at the beginning of the pandemic of, let's let the states, there's no national strategy for PPE, let the states get their own. And it turned every single state into an international procurement and FDA and mini FDA. And the stories of counterfeiters hoodwinking states is pretty bad. Vendors that were selling products that didn't have access to, fake 3M resellers, fake gloves, as you saw in the video. And that is really a problem. You can't throw the states to the global wolves. That's just what we learned. That's part of why we're really concerned about importation, because states don't have themselves the rights of extradition to bring criminals to court who sell us counterfeit medicines. And we've seen states try and even go to Canada to regulate online pharmacies there several times, Illinois, Minnesota, Maine. And their attempts to regulate pharmacies from afar out of their jurisdiction have not worked well. There's a great point here from Tom. He's pointing out that the 2019 National Drug Threat Assessment from the DEA has a lot of detail on the fentanyl problem. If you saw in my slide where I was talking about it, that was the report that was next to my face. It's a great report. It talks about pill presses, talks about fentanyl. It talks about illicit drugs and illicit drugs being tainted with fentanyl. It's really, really good. I read it every year, and I highly recommend you read it. Thank you, Tom. Tom is also one of our founding board members, so that's always appreciated. Here's a great question. Came through the chat. Any thoughts on how discussions or advances in traceability might help in counterfeit prevention, similar to FDA's Smarter Food Initiative addressing tainted food that could one day allow patients to check authenticity? So it turns out that America has one of the very best track and trace systems out there. The Europeans have the Falsified Medicines Directive, which also actually provides for traceability. But I'm not a track and trace expert, but I know enough of it to play one on TV. I believe we passed the deadline in the 10-year rollout that started in 2013 that all medicine being produced now must be serialized on the factory floor. So there's a trackable number, and that ends up going as far as the pharmacy shelf. So every entity along the supply chain, including logistics providers, are required to keep track of that number and the person they bought it from. And if you look, there is a whole great set of 3 papers from the HHS Inspector General, where even though this system is only 7 into the 10-year rollout, they went to pharmacies, they pulled bottles off the shelves, and they started scanning and traced back, touching every vendor all the way to the factory floor to do track and trace for those medicines. And in about 75% of the cases, they actually were able to touch every vendor and see every vendor. So we have a great system. Things that blow holes in it are a problem, and I talk about Canadian drug importation too much, but that is one of them because Canada has no track and trace system. But our track and trace system today, we don't need to do anything except complete it and commit to keeping it strong and not poking holes in it. It's a great it has the potential to be the best system in the world, if not already. So I'm very, very excited as it continues to roll out. It's got, it's a combination of technology and regulatory. And that's the key, by the way, to safety. Safety in the supply chain is technology and strong regulation. You can't do technology and just say blockchain and have it magically be secure. It has to have technology and strong regulation. And we've got both of those in track and trace. And hopefully we will finish the rollout and commit to it as a nation and continue to actually see improvements. I think that is all the questions that I see at the moment. We are 7 minutes past time. Again, this video will be on YouTube today, and you'll see our blog post with lots and lots of resources here on our website at safemedicines.org. You can reach Savannah and I below. And please subscribe to our YouTube channel. And if you're a not-for-profit, please join PSM. We will make sure that we can accommodate your budget, but your participation, the ability to work with you, that's the key part for a nonprofit like us. Thank you very much. If you have further questions, please email us at these email addresses, and we will talk to you soon.